There we go. Today we're going to do medications, which is part of the pathology section of the MBLEx. And I thought, I think a good way to start with that is actually by doing some practice questions. All these questions are from the AMTA app, which you probably know, I think is a really great resource for us. So let's get rid of the sidebar and zoom in a little bit, and you guys just let me know if you cannot see or if you cannot hear, if there's any problem, okay? At the beginning of the questions, not all the questions that I saved for this are on medications, but let's go through them anyway. So if you guys can unmute yourselves, and I'll begin to put, and so that way you can call out the answers that you think they are, right? And again, so fill in the blank. When massaging a client with osteoporosis, the massage therapist must exercise caution during the use of techniques that cause therapeutic inflammation, the use of compressive forces, scalp massage, or relaxation techniques. So that's clients with osteoporosis. So what do you guys think? Caution with techniques that cause therapeutic inflammation, caution with techniques that use compressive forces, caution with scalp massage, or caution with relaxation techniques. What do you guys think? If you don't know, just call out something. So someone call out something. So both of you guys unmute and just call something out. Vincent, which one do you think it is?
I believe it's A.
Yeah, the use of techniques that cause therapeutic inflammation. All right, that
Yes.
is not a bad guess. It is not a bad guess, but specific to osteoporosis, what do you think? What do you think the answer is? Or rather, specific to osteoporosis, what's the risk with osteoporosis? Do you know what osteoporosis is, Vincent? Can you tell me
I
that?
do, but I'm only partially paying attention right now. I got stuff going in the background. I'm trying to stop. So,
Okay.
I'm
All
sorry.
right. It's all right. I'll come back to you. No, I'm familiar with that. That's okay. Okay. So I'm sorry, I can't see your name. So the other student who's here, can you please tell me what is osteoporosis?
Honey, that's you.
I think a D.
Okay. D, caution with relaxation techniques.
Yeah.
Not quite. So can you tell me what is osteoporosis? So osteo refers to
bone.
osteo is
bone.
bone. Yes, that's right. Yeah. And porosis, like porous, when something is porous, it's got like holes in it, right?
Yeah.
So osteoporosis means bones with holes in it, or bones that are what?
Bone with a hole.
Yeah, or bones that are weak.
Yeah.
Yes. So which one, what's the danger with osteoporosis? That they can fracture, that they can break. That's the danger. So if the risk is that the bones could break more easily than a normal bone with osteoporosis, which one do you have to be careful with?
Okay.
Go ahead.
Not using compression force.
That's right. So pressing down. You have to be really careful with that with osteoporosis. Okay. And one way that you can tell if someone has osteoporosis is through the medications that they take. They won't always remember to tell you they have osteoporosis. They might not think it's relevant. But if you find that they're taking Boniva, if you say, can I have a list of all the medications you take? And Boniva is on there, you know, or calcium plus vitamin D, or chondroitin or something like that is on there, then you need to ask, why do you take calcium with vitamin D? Why do you take chondroitin? Why do you take Boniva? Yes, the use of compressive forces with osteoporosis. Okay, fill in the blank. A client is on Ritalin. Ritalin. Has anyone not heard of Ritalin? Ritalin is an amphetamine. Amphetamines are stimulants. Speed, basically. She is most likely being treated for a nervous system disorder, respiratory disorder, cardiovascular system disorder, or reproductive system disorder. Which one? So respiratory system disorders, those are treated usually using things like bronchodilators. Sometimes be very careful with that stuff. I got a lot happening over here too. Cardiovascular system disorders are treated with things like anticoagulants or anti-clotting agents, beta blockers, reproductive system disorders. Well, I'm not really sure about those. I don't know a lot about those, but I don't know. I'm guessing like some kind of hormone replacement therapy. So that leaves nervous system disorder. So when someone takes Ritalin, it's usually to help them focus. It's to help their brain fire more quickly, more clearly. It's used a lot with severe ADHD. And as an amphetamine, it's very good at doing that. It makes the brain kind of speedy. So it'd be a nervous system disorder, specifically for something like ADHD. Attention deficit hyperactivity disorder. I know something about that.
So do I.
Oh yeah.
Yeah. Had it my whole life.
Yeah, me too. And I got news for you. You always will.
Yep.
Yeah, I got kids and they have it, and my parents had it, and yeah. All right, so now moving on, of the following options, which one does not require a physician referral? So warm, tender, and hard veins, a pulse that is over 90 beats per minute, a pulse that is below 60 beats per minute, or a respiratory rate 15 breaths per minute. Which one do you think does not require? So another way of reading this is that when it says which does not require a physician referral, another way of reading this is 3 of these answers are normal or safe, and 1 is not normal or safe. Which one is the one that sounds like it's not normal, not safe?
D.
B, a pulse over 90 beats per minute. Okay. Oh yeah, 90 BPM is fast. It is fast. But there are limits, there are numerical limits to what they consider to be dangerous for the rate of pulse. There's an upper limit for fast, and there's a lower limit for slow. So I would say that it's, I would have actually picked warm, tender, hard veins, but the answer is that, yeah. But the answer is actually a respiration rate of 15 breaths per minute. And the explanation, which I saved because I always miss this one, is that all the answer options are assessments of the cardiovascular system. A normal respiratory rate is 12 to 20 breaths per minute. Therefore, 15 breaths per minute is well within the normal range. I would not require a physician referral. So which one of these would not require a physician referral? Oh no, I'm sorry. I think I reversed those for you. I said 3 of these are normal, and 1 is not normal. Is that what I said? Okay. Well, what I should have said was 3 of these are not normal. They are dangerous. And 1 of them is normal, does not require a physician referral. So anyway, moving along, the answer is 15 breaths per minute. So all of these are outside of normal ranges. So a pulse over 90 beats per minute a pulse below 60 beats per minute are both well outside of the normal range and therefore indicate dysfunction of the circulatory system. And then warm, tender, hard veins are also an indication for a referral, since these signs may indicate something like a deep vein thrombosis or an infectious process. You guys want to look at that any more closely, or are you ready to move on?
The only thing I got is I wouldn't be able to know if you breathe in 15 breaths per minute. I wouldn't pay attention like that.
Yeah, well, keep in mind that this is a test, right? It's not,
Yeah.
It's not real clinical guidance. So, so the test just says, you've noticed X, Y, Z. You've noticed the rate of breath is 15 breaths per minute. So, what do you think about that? All right. So, which one is a contraindication? Oh no, what is a contraindication? A condition in which there is no benefit or harmful indication. So no benefit and no harmful indication. A condition for which massage. Okay, let me read the possibilities, please. A condition for which massage would be beneficial, the general relaxation massage for pleasure, or a condition for which an approach would be harmful. And the answer is D, a condition for which an approach would be harmful. Thank you. You guys just let me know if any of these questions need explanation, if you're confused by any of them, if you want to spend any extra time on them. Okay, which of the following drugs impacts the central nervous system and acts as a depressant? Is it cocaine, nicotine, amphetamines, or narcotics?
Narcotics.
Narcotics, that's right. That's right. Narcotics all drugs influence the central nervous system through a variety of effects. Examples include stimulants like caffeine, nicotine, amphetamines, and cocaine. Depressants include alcohol, narcotics, tranquilizers, barbiturates. Hallucinogens include LSD, PCP, and marijuana. A regular client comes in for their monthly massage. When they arrive, they say, "I'm so excited for this. I have the flu and I've had a fever for several days. I'm so glad to finally have a massage and relax. I know this is going to help. How should the massage therapist proceed?" Proceed with the massage using only long gliding strokes. Proceed with the massage. Proceed with the massage, but use only deep pressure instead of long gliding strokes, or reschedule the session.
D.
Reschedule the session.
Yes, reschedule the session. That's correct. Did we have this question before in another battery of
I think
questions?
we did.
Mm-hmm.
I think
Okay.
so.
All right. All right.
Sorry,
very
I got
busy-
here so late, by the way.
No, look, you do what you got to do, right? In a
Yeah.
very busy
I had
clinic, in a very busy clinic, a new patient arrives 15 minutes late to his appointment. Rushed, the therapist begins the session quickly without spending much time talking with the client about his health history. After the session, the client calls to tell the therapist he has a rash along his back. Which of the following is the most important step that the therapist should have done differently? Ask the client if he has had a massage before. Ask the client about any allergies prior to treatment. Turn the client away for arriving late. Ask the client about his feelings toward massage. Which one do you
B.
guys think?
B.
Yeah.
Yes.
Yeah. Ask about allergies. A massage therapist, please let me know if we've had these questions, any of these questions before. Okay. You just interrupt me as I start to read it. Because I might want to skip the ones we've already had in other lectures. A massage therapist notices an open sore on a client's right thigh. When she asks about it, the client says it was caused by a recent bicycle accident in which they sustained no other injuries. There are no signs of infection. What is the most appropriate action for the massage therapist to take? Avoid treating the thigh, continue as normal. Massage is contraindicated, so send the patient home. Avoid treating the thigh and entire lower extremities. Send the patient home and call their doctor to alert him or her of their condition. What do you guys think?
Probably C.
Avoid treating the thigh and the entire lower extremities.
I was gonna say A, but
Yeah, probably A.
Yes, probably A. Why is it A, Dora? Why is A the more correct answer?
Because you don't want to neglect the whole lower body either.
Yes, and also because it's on the client's right thigh.
Yes,
And an open sore is what kind of contraindication? Local or systemic?
local.
That's right. So you just have to avoid the local area. So it's just that one leg. Yeah, avoid treating the thigh, continue as normal. A client informs you that he is taking omeprazole, which is Prilosec. What type of health problem is he most likely to have? Is Prilosec used to treat cardiovascular, gastrointestinal, hormone, or respiratory problems?
Mm,
B.
Gastrointestinal, that's right, that's right. Prilosec, omeprazole, is used to treat acid reflux or GERD or heartburn. Also used for ulcers. Which position should be avoided for clients using decongestants? Supine position, prone position, right side lying, or left side lying?
B.
Prone, yeah, that's correct. Because if someone is taking decongestants, they're taking it because their problem is congestion in the nasal or in the what is it called, supraorbital or nasal sinuses, in the sinuses. And if you put them face down, their sinuses will fill up with fluid. During an intake assessment, you learn that the client has a prescription for vasodilators. Given only this information, which of the following conditions are they most likely to have? If they're taking medication for a vasodilator, are they taking those medications because they have hypotension, hypertension, asthma, or anxiety?
Hypertension.
Are you saying hypotension or hypertension?
B.
Hypertension, yeah, that's right. So vasodilator, dilate means to open, and vaso means vein. So that's the opening of the blood vessels. Vaso doesn't mean vein, it means blood vessel, it means vessel. So the opening of blood vessels, arteries and veins, is because there's too much pressure. The pressure of the blood against the walls or of the vessel, or the pressure of the vessel against the blood. Yeah, hypertension. Okay, fill in the blank. A massage therapist sees a client who is taking analgesics. During this session, the therapist should, analgesics, right? Should proceed with the massage as usual, since analgesics will have no effect on the treatment. Emphasize inflammatory techniques and increase the pressure of the techniques. Use more aggressive techniques. And since pain perception is reduced, avoid inflammatory techniques and reduce the pressure of techniques. Which one do you think is most appropriate?
probably A.
Proceed with the massages. Go ahead.
Go ahead.
Proceed
D?
with the massage. Emphasize inflammatory techniques and increase the pressure, or proceed with the massage as usual, since analgesics will have no effect on treatment. Well, what are analgesics for? This is one of the things that we're going to cover tonight.
Allergies.
It is used sometimes for analgesics. Analgesic or analgesia means pain, and a or an means anti. So these are painkillers.
Oh,
Yeah. So someone who is on a painkiller, they don't feel pain as well as other clients, right? So your choices are: use more aggressive techniques since pain perception is reduced, or avoid inflammatory techniques and reduce the pressure of techniques. So which one do you think is more appropriate? Like, which one is the safer?
D. Avoid.
D. Did someone say why?
Avoid inflammation.
Yes, avoid inflammatory techniques and reduce the pressure of techniques. Yes, and the reason is because Analgesics, let's see. Over time, regular massage can reduce the client's needs for these medications. Since these analgesics inhibit pain perception, the therapist must exercise caution to prevent injury and bruising. Because these medications reduce the perception of pain, it is not appropriate to use aggressive techniques. The client will not be able to accurately say if the massage is too painful or aggressive, and these techniques can result in further pain and injury. Does that make sense to everybody?
Yes.
Mhm.
Okay. Fill in the blank. Which ones are not classified as respiratory medications? Antitussives, bronchodilators, antihistamines, or diuretics?
Antihistamine. Yeah, I would say.
Okay.
Sorry.
Not a bad guess, but histamines, they cause like swelling and redness, but they cause swelling and redness, like all the tissues of the body are vulnerable to antihistamines or histamine responses, including the respiratory tract. So a histamine response is something that happens in the lungs or the nose or the other parts of the respiratory tract, and people do take antihistamines for that. Bronchodilators dilates the bronchi are in the lungs. Tussive means coughing. So antitussive is anti-coughing. So these first three are all relevant to the respiratory system. It's diuretics, which are used to make someone pee, to drain water out of the body. They're used sometimes for high blood pressure, for example, or for like water retention, like for edema. Not respiratory medications, but used to treat hypertension. Yeah, they're like they affect the urinary system. Fill in the blank. Narcotic medications are used to prevent pregnancy, reduce inflammation, relieve pain, or regulate blood pressure. Which one?
To relieve pain.
Yeah. After an injury, the inflammatory response is activated. Which of the following is not a sign of the inflammatory response? Is it bleeding, heat, swelling, or pain? So the inflammatory response, think about like an ankle, a sprained ankle, or an allergic reaction, right? Like a bee sting,
Bleeding.
or yeah, it's bleeding. Yeah, bleeding does not happen necessarily during like a contact dermatitis, skin reaction, or a sprain. Bleeding doesn't necessarily happen during those, but you definitely have some heat, you have swelling, and you have pain. Any more easy to have. Okay. Yeah. Okay, fill in the blank. Ibuprofen. Ibuprofen is not an over-the-counter medication. And NSAID, what's NSAID stand for? Non-steroidal, fill in the blank.
Inflammatory.
Very good. Yes, non-steroidal anti-inflammatory drug. Yes, correct. Not an NSAID, not an analgesic. Analgesia meaning pain, an meaning away from or anti. Not an anti-pain medication, or not an expectorant. Expectorant means coughing up phlegm, expectorating phlegm. So which one is ibuprofen not? Did you say D? Having a little trouble hearing you. Did you say D?
Mhm.
Okay.
What did you What did you
We-
say
we-
the third one is?
The third one, an expectorant, causes you to expectorate. Expectorating means loosening up phlegm in the lungs and then coughing it out. So that's
Oh.
expectoration. Yeah.
Mm.
Yeah, so it's an expectorant. Ibuprofen is not an expectorant. Ibuprofen is not an expectorant. Ibuprofen is the answer for the question, which is ibuprofen is not a expectorant. Fill in the blank. A therapist's client is on blood clotting medication. As a result, the therapist should perform the massage as usual, always perform deep tissue massage for this client, provide deep pressure and aggressive techniques to break up tissue restrictions, avoid methods that may cause bruising, including compression, friction, percussion, and skin rolling.
D.
D, yes, correct. Again, let me know if you need explanation for anything. Fill in the blank. Disinfection is an aseptic method that kills all pathogens, kills almost all pathogens, puts up a barrier against pathogens, stops the growth of most pathogens.
Stops the growth.
I don't think so.
Disinfect. Oh,
Yeah. Kills almost all pathogens.
okay.
Yeah. Let's see. What is stopping the growth do? Antisepsis. Antisepsis stops the growth of most pathogens. Antisepsis. Huh. Yeah. Sterilization kills all pathogens. Fill in the blank. A client's mood and behavior are most likely to be affected when they take medication to manage what? Circulation, dendrites, neurotransmitters, or peristalsis.
C.
C, that's correct. Neurotransmitters, that's right. When medications are used to manage neurotransmitters, mood and behavior are affected. Change in neurotransmitter concentrations at various synapses causes changes in behavior. Typical behaviors and moods affected include the response to pain, the response to pleasure, and survival behaviors. Different people can respond in different ways to a decrease or increase in levels of neurotransmitters. Major neurotransmitters include acetylcholine, serotonin, histamine, epinephrine, dopamine, and norepinephrine. Dendrites are the branches of a neuron. Circulation is the flow of blood or other fluid through the body. Peristalsis is the concentration of smooth muscle, the contraction of smooth muscle, as in the digestive tract. A massage therapist begins seeing a client who has Parkinson's disease. The client takes regular medication for this condition. Given this, what is a potential effect of massage for this client? Parkinson's disease. So that's a disease where there's not very much dopamine, I think. And they're basically supplementing dopamine. So they're adding dopamine to the brain. So is a potential side effect of massage for a client like this, is it excessive drowsiness? Is it
Yes.
dizziness, the inability to relax, or bruising? Excessive drowsiness, yeah. Did we have this one before?
We had one similar, but I don't
Okay.
think it was.
Okay. I have a silly question for you. Have we done the medications lecture?
No.
Okay, good. I guess maybe I need some supplements. So there's a lot on this slide. There's a lot in these slides. The pages that are in gray with a gray background like this, there's only 2 of them. They're just interesting numbers. You don't have to know them for the exam. I just thought you'd find them interesting. All the other ones, try to really know the information, right? And it may look like a ton of information, but for example, on this page, you've already heard of most of the medications, right? Like analgesics, OTC, and prescription. OTC means over the counter. Prescription means by prescription. Analgesics is painkillers, right? Anti-inflammatory drugs, especially non-steroidal anti-inflammatory drugs. Muscle relaxers, you've heard of those. Antibiotics, you've heard of those. Has anybody, let me know if you have not, if there's any of these that I'm saying, oh, you know these and you haven't heard of them, okay? Diabetes management drugs. I don't think that those are so much part of the common lexicon. anticoagulants, antidepressants, anxiolytics. I don't think most people have heard of those, but a good number of these, most of these you have known. So we just need to figure out how massage can affect these, or what kinds of variations patients or clients are vulnerable to if they're taking these things, like what, excessive drowsiness or inability to relax. Like somebody who's on Ritalin would have trouble relaxing. Someone who's on like an anticoagulant would have a greater risk of bruising, for example. That's mainly what they're going to ask you on the MBLEx. Okay, so you should know the most common drugs which increase the risk of patient injury. That's what I was saying. When combined with massage or body work. And here is a link. If you just go to this slide and then highlight the link. Actually, maybe I can do this for you. Yeah, good. So now it's a hyperlink. You should be able to just click on it. Yeah, and it'll take you to page with 10 of the most common medications that interact with massage. So I just want you guys to know how common medications are, how common prescription medications are in the United States. So in 2015 to 2016, that was like Obama. 45% of people surveyed said that they use prescription drugs. It's probably a little higher now. And prescription drug use increases with age. So it's more common in people in their 60s than it is in children or teenagers or people in their 20s. Prescription drug use is highest among non-Hispanic white persons, followed then by non-Hispanic Black persons, and then lowest among non-Hispanic Asians and Hispanic persons. And then the most commonly used types of drugs include bronchodilators for children ages 0 to 11. So that opens the lungs so that they're being treated for asthma. So that tells you the condition most children are medicated for is asthma. Central nervous system stimulants for ages 12 through 19, that's ADHD. That's to treat ADHD for the most part. And then antidepressants for ages 20 through 59, and then lipid-lowering drugs for ages 60 and over. It really sounds like the typical like progression of the American life, you know, like asthma being managed as a kid. They push you hard as a student, and it's like really difficult to keep up. And then you get into the workforce, and you're like, oh crap, what now? You know, like now I've arrived. This is it. And then you get so stressed out that you don't eat very well and you end up with high cholesterolemia or whatever. Okay, the use of the most commonly used prescription drug types in the past 30 years by age group. So 0 to 11, 12, 19, 20 to 59, and 60. And you can see that it starts with antibiotics like penicillin, and then bronchodilators for asthma. And then there's an increase here with central nervous system stimulants, antidepressants appearing 20 through 59, and then heart medications and lipid-lowering drugs for high cholesterol, ages 60 and over. So these are the classes of medications that I recommend you become familiar with, like really familiar with. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, basically. So this last one is not its own class. It can be, this last one can be some of these other categories, or you just have to make a note of when a medication causes dizziness or is known to cause low blood pressure, orthostatic hypotension. Orthostatic means when you change the angle of your joints, basically, like when you stand up from a sitting position and the blood drains from the brain for a second and the person gets dizzy. And it's dangerous, you know, it's dangerous. Like I'm an acupuncturist, and I had a patient pass out because they had not eaten. They were an athlete. They hadn't eaten all day. And if I weren't there right in front of this person to catch her, she for sure would have ended up on the floor. Would she have hit her head? Like, what kind of injury would she have gotten? It's definitely dangerous. orthostatic hypotension. So what classes of medication affect a client the most during massage? Well, it's these 11 or 12. So analgesics, painkillers, which can include opioids, antibiotics, antidepressants, anti-inflammatories, which also include NSAIDs. NSAIDs can be analgesics. NSAIDs are also anti-inflammatories. Steroids are also anti-inflammatories. Hold on, my microphone just cycled. Are you guys still hearing me okay?
Yes.
Okay, great. Antipsychotics. What's an example of an antipsychotic? Okay, well, I'll look that up later. Antipsychotics, anxiolytics, drugs that are taken for anxiety, blood glucose regulators. So that's predominantly insulin. People taking, when they regulate their blood glucose, usually it's predominantly insulin. Anticoagulants, which are called blood thinners, blood regulators, or blood thinners or blood regulators. Platelet aggregation inhibitors are also blood thinners or blood regulators. Cardiovascular agents such as beta blockers, ACE inhibitors, and diuretics, and then sedatives, skeletal muscle relaxants or muscle relaxants, and then any medication that causes dizziness or orthostatic hypotension. So let's get into some of these specifically. I won't be covering all of these. However, you definitely should know all of these because you're going to be responsible for all of them on the exam. You know, these questions are randomized, so you don't know what you're going to get. You might get 10 out of 11, 10 out of 12. You might get all 12. You don't know when you go in. So analgesics. So there are two types. There are non-opioid, and then there's are there opioid? No, I guess not. Okay, so regarding analgesics, there are two types. There are non-opioid, which is most commonly non-steroidal anti-inflammatories. That's NSAIDs, and the classification is big, right? Classification is generally miscellaneous, so use it for whatever has pain. So they could add an analgesic to a drug combination, to like a routine of pills that people take for asthma. You know, if someone's having sore muscles or pain as a result of asthma, they might add analgesics. If someone, they might add it to a course of antibiotics if someone is having a lot of pain there, or for injuries or chronic pain conditions. Let's see. Let's see. You don't need to know this, but they relieve pain. They relieve pain differently from other categories of drugs like opioids. Oh wait, I guess I misspoke. Okay, so no, I see. Anti-inflammatories are separate from analgesics, and analgesics can be non-steroidal anti-inflammatories. Okay, there's basically two kinds, which are acetaminophen and ziconotide. You don't really have to know ziconotide. You do not need to know ziconotide. It's mainly administered by IV in the hospital. But acetaminophen is so widely used. It's what's in Tylenol, and they're not really certain how it works. You know, it's good to know the mechanism of how these things work. Like, does this medication supplement dopamine? Does this medication slow down platelet aggregation? Does this medication make the body more inhibit the body's ability to retain water? Well, the mechanism for acetaminophen is not entirely clear. It's so widely used that you sometimes find it in places where you wouldn't expect it. You know, like in like Alka-Seltzer Plus. Alka-Seltzer is something that people take for upset stomach, which includes, you know, diarrhea and bloating And it also includes discomfort from those things. But it contains acetaminophen. People are not always clear on that. NyQuil. NyQuil is something that people take to help them sleep better when they've got like stuffy nose and coughing, and they want to cough less. They're not breathing very well. They also have headache, body aches, sore throat. Those pain are addressed through acetaminophen. Mucinex breaks down mucus and makes it easier for the body to cough it up or expectorate it out. And it's not entirely clear that is accompanied by pain, but acetaminophen is in there. So people will come in and they'll take stuff regularly, and they may not tell you about it, right? So you have to ask them, are you taking any medications even over the counter? What medications and supplements are you taking? They may be taking Robitussin because they have a little cough. Well, that as long as they're taking Robitussin, they are less able to feel pain, so that makes them more susceptible to bruising. Okay, relieves pain. It also is a fever reducer. Oh yeah, it's in a lot of medications. A lot of people don't realize that, and that does create a danger of overdose or a danger of toxicity. Like if someone is allergic to acetaminophen, which is not very common, but it does happen. And when it happens, it's apparently very dangerous. I don't know that much about it. An allergy, being allergic to it can be life-threatening. There's no way to find out ahead of time. There's no test. You just have to try and find out. Great. I'm next. All right. So relevant for you guys, for the massage therapist, massage is not contraindicated if someone's taking acetaminophen. You still, or any kind of analgesic, non-opioid analgesic, non-steroidal anti-inflammatory, massage is not contraindicated. But they are going to have lower pain sensitivity. So the safest thing to do is to use less pressure than you normally would. Any questions about analgesics, acetaminophen, or how you have to adjust your approach as a massage therapist? You're going to get confused. So the minute you feel confused and you want clarification, just ask me, hey, can you go over analgesics again? I will do a quick version. All right, platelet aggregation inhibitors. Platelet aggregation inhibitors are a type of anti-clotting agent. They prevent clotting. They prevent the formation of platelets. And yeah, according to what I read, it's really only aspirin that inhibits the aggregation of platelets. Do we have warfarin and Coumadin on here? No. Anticoagulants are blood thinners. Yeah, so an anticoagulant is different from a platelet inhibitor, platelet aggregation inhibitor. Okay, we'll go over that in a minute. Really just aspirin, which is also a salicylate or a salicylic acid. That's another thing that people can have an allergy to. It's also commonly used for pain. So someone may be given aspirin if they have pain or fever or some kind of inflammation. So it's really handy for you to know if somebody says they're taking aspirin, or that they take a baby aspirin every day because their cardiologist told them to. They have no idea what it does. You have to have an idea of what it does. It thins the blood, it prevents blood clotting, it reduces the chances of blood clotting. It's used for treating patients who have had a stroke, a myocardial infarction, angina, which is chest pain, or heart pain due to I think that's actually due to ischemia, due to a lack of sufficient blood flow to the heart. Relevant for massage therapists, these people will bruise more easily. The blood is quote unquote thinner. So avoid the recommendations made by massage therapy places like the AMTA, good solid source, is to avoid deep tissue massage. That's really important to know, that they're definitely going to ask you something. They're definitely going to ask you what you should avoid if they ask you about platelet aggregation inhibitors. Also, strokes like deep kneading, muscle stripping, trigger point compression, those are also contraindicated. And then focus more on things like gentle compression, right? Rather than trigger point compression or deep tissue. Use friction, and you can use petrissage. You should definitely read this article here. Massage and medication. Okay. Oh, I want to clarify one thing, and that is that platelet aggregation inhibitors are different from anti-clotting agents, Coumadin and warfarin. Let me just get you a name for platelet aggregation inhibitors, just so you've heard it, like the brand names. Okay, so there's aspirin, salicylic acid. Is that the only drug that they? Dipyrimidol, Integrin. I'm sure you don't have to know all these, but if you've heard them, it won't be intimidating, right? Platelet aggregation inhibitors. Yeah, Integrin, vitronectin. Okay, and then let's look at warfarin and Coumadin. Warfarin and Coumadin. Coumadin and warfarin are the same. So Coumadin is a brand name that's like owned by some company. It's owned by Jantoven and Coumadin, and warfarin is the generic name. And those are blood thinners. So it can treat blood clots, and it looks like aspirin prevents blood clots. So hopefully you guys see difference. Yeah, both are anticoagulants. One is a platelet aggregate inhibitor, and the other is a blood thinner, and both are anticoagulant medications. Okay, if we look at medications organized by disease type, this is really helpful because start video. Okay, if we look at diseases, medications by disease type, this is helpful because if someone comes in and they say, I have a particular disease, I have like arthritis, I have diabetes, you know to ask them, okay, what do you take for arthritis? What do you take for diabetes? And if they say, well, I take acetaminophen, I take NSAIDs, then you know that you should not do deep tissue massage for that person. If they say, I'm taking like corticosteroids or disease-modifying anti-rheumatic drugs, then you probably don't have to worry about excluding deep tissue massage. But let's get into this a little bit more. So acetaminophen, which we mentioned earlier, it's often given for pain. Tramadol and narcotics also for pain. Non-steroidal anti-inflammatories such as ibuprofen and naproxen, those are given for pain and also to reduce inflammation. Corticosteroids are anti-inflammatories such as prednisone, cortisone. Then disease-modifying anti-rheumatic drugs, DMARDs, biologics including etanercept and infliximab. You don't need to know these. I mean, I just included these two categories because I want you to have heard them. But really, what you need to think about, what you need to know, are how to modify your treatment approach in someone who's taking acetaminophen or NSAIDs. So people who take pain relievers, that's analgesics like acetaminophen, narcotics, tramadol, they have altered pain perception. Oh, it's also NSAIDs, acetaminophen, and narcotics. People who take pain relievers have altered pain perception. They also sometimes have low blood pressure. They can experience dizziness, bleeding, or bruising. So consider changing your treatment plan for each of these. So for bleeding and bruising, we mentioned you don't use deep tissue for them. Don't use trigger point compression for them. Use gentle compression and use gentle compression and friction and petrissage. So question, if someone has low blood pressure, what do you need to watch for? What do you need to try to prevent? What kind of accident? What happens when somebody has low blood pressure and they stand up from a laying down position or a sitting position?
They'll get dizzy.
They can get dizzy, and at the worst case scenario, what can happen to them?
They can pass out.
They could pass out. Yeah, that's right. And then yeah, bleeding or bruising, we covered that. Consider changing your treatment plan for them. So low blood pressure, dizziness, if they ask you about those on the exam, it's going to be something relevant to someone passing out and falling, or it's going to be someone having an unpleasant dizzy sensation while you're working on them. It's probably going to be the former. It's probably going to be passing out. People who take corticosteroids, they can have swelling of the legs, thinning of the skin, tendency to bruise, higher blood pressure rather than the low blood pressure that you see with painkillers, high blood pressure with corticosteroids, weakened immune response, osteoporosis if used long-term, right? So corticosteroids can make the body pretty significantly weak in many ways. There's the gathering of fluid in the lower legs, edema. There's the thinning of the skin and of the blood vessels, slower or weaker immune response, and weakening of the bones. So if someone has a weakened immune response, it is imperative that you be absolutely sure that the person who was in the treatment room before that client was not sick, right? Did not have a cold or a flu. If someone has high blood pressure, I believe there are certain specific strokes that you have to be aware of, techniques you have to be aware of not to do. Same with bone fractures. Okay, if your client is taking corticosteroids, avoid the injection site if they take injected corticosteroids. Avoid the injection site during massage, and then avoid deep tissue work. Use more gentle strokes instead. Diabetes, when someone says they have diabetes, they're usually taking, they're either taking some insulin supplement, which can be a name like glucophage or Glumetza, right? Just insulin is good. Sometimes they take these things here, Avandia. Avandia is particularly nasty drug. I don't know a lot of people who take them, and I doubt that this class of medication is like so widely used anymore. There's a huge lawsuit over Avandia. Yeah, they're still using it to treat type 2 diabetes. So type 2 diabetes is adult onset. It's 100% curable through diet and movement. Keep in mind that it's not always possible for people to alter their movement routine. It's not always possible for people to alter their diet. Talk to like someone who drives for a living and ask them about diet. It can be really, really challenging. It can be really hard, just because of availability. Okay, side effects of diabetes medications. I should have listed those. So there can be some dizziness. There can be edema. They can have edema. Side effects. Side effects of these things. So local redness, swelling, itching at the injection site. There can be a fat buildup around the skin that's not really relevant to you guys. Fat breakdown under the skin, weight gain, constipation. So those aren't contraindications, but you can help people with constipation, right? Because you can work on the abdomen, like gentle circular rubbing on the abdomen can help to stimulate peristalsis. How about side effects of Avandia? Yeah, much worse. So upper respiratory tract infection, headache, back pain, high blood sugar, fatigue, sinusitis, diarrhea, low blood sugar. I mean, serious side effects include heart failure, heart attack, liver damage, bone
Jeez.
fracture. Say again?
That's a lot of side effects for
It is a lot of side effects. Yeah.
really bad ones.
Yeah, that's right. That's right. So I'm going to put bone weakness, fracture, and I'm also going to put headache and sinusitis. Headache, sinusitis. I seriously doubt that they're going to ask you about the specific side effects of Avandia, but at least you have them, right? At least you have them. And with things like sinusitis and headache, they would have to have the symptoms for you to be worried about it. Like, you're not going to cause sinusitis by doing massage on someone who takes Avandia for type 2 diabetes. But you don't want to put anyone face down in a prone position either who has sinusitis. Okay, so there are two types I forgot to mention: type 2, which is adult onset, and then type 1, which is childhood. So the recommendations, there are recommendations aside from the side effects, and they will be asking you about like, which condition needs a physician's referral or some kind of supervision. They definitely will ask you about those. You should get a physician's referral for massage in someone who has diabetes. They recommend that you start with shorter sessions. So instead of an hour session, start with 30 minutes and do 15, do 45 if they're okay with that, and do 60, build up like that, just so you can see, is this going to wipe them out? They're going to feel exhausted, dizzy? Is there going to be some kind of, onset of pain afterwards? Let's, take it easy at first. Here's a good one. When you schedule massages, try to do the massage when you know they're going to have their medications. Like, make sure that the client has eaten, and make sure that the client has eaten prior to the session. So you can just say, if somebody says, I want to come in Tuesday at 7 p.m., you can just say, okay, will you have your diabetes medications available to you then, or will you have taken them by then? That's fine. But if that's the day when they have to get their insulin refilled, or their other medications refilled, not the best day to schedule that session. And make sure that the client has eaten prior to the session. Look for any kind of wounds. So that can be, like ulcer looking wounds on the skin, which happen on the extremities in the advanced stages of diabetes and chronic diabetes. Or it can be redness, itchiness, pain around the injection sites. Ask whether your client is experiencing any sensory loss or alterations. Also, tingling, numbness, leg cramps, fatigue, muscle weakness. Also, those are also signs of chronic diabetes. As the vasculature starts to change, as the blood vessels start to break down the extremities, you sometimes get things like that. Hypoglycemia, also known as insulin shock, can be life-threatening. Always ask clients to check their blood sugar levels prior to the massage. And insulin-dependent clients should always have a source of sugar available. For these clients, keep fruit juice or regular soda, not diet soda, because it doesn't contain sugar. Keep regular soda on hand, and call 911 if your client is drowsy or confused, or is difficult to rouse after massage. Drowsy, I don't know about, but that's what massage sources are recommending. So keep it in mind. Clients who take a combination of diabetes medications plus other drugs like non-steroidal anti-inflammatory drugs, aspirin, ACE inhibitors, SSRIs, ginseng, they're at higher risk of hypoglycemia. They're at higher risk of a blood sugar crash, insulin shock. And people who have diabetes, especially the older they get, the more diabetes can coexist with other diseases. Parkinson's disease. So I'm starting to feel myself a little overstimulated and or a little saturated, and I made these slides. So would you guys like a break? Well, actually, I retract the question. It's 9:07. Let's take a break. Come back at 9:17.
Okay,
All right. See you guys in a bit.
thank you.
Yes,
Okay.
you're welcome. All right. Parkinson's disease. Parkinson's is characterized by shakiness, sometimes drowsiness, like shaking, also called tremor. These are terms you guys should know. Tremor, hands, arms, legs, jaw, head. Muscle stiffness, where the muscle remains contracted for a long time. Slowness of movement. Impaired balance and coordination, sometimes leading to falls. Again, we see that falls are taken seriously, right? So Parkinson's is a result of low dopamine levels. So what you find are in the drugs, you find dopaminergics. So a dopaminergic like levodopa, these are all brand names, levodopa, dopar, laradopa, ledopa. You find that dopaminergics, which literally means related to dopamine, they increase the dopamine activity in the brain. And I think that means the manufacture of dopamine, increase the dopamine related activity. There may be other mechanisms, like sometimes the way that that science works with insufficient neurotransmitters is by slowing down the body's ability to absorb or to reabsorb dopamine in places like the synaptic cleft, and that makes more dopamine available, like freely hanging out in the cleft, and so it can be absorbed by the receptor cells for a longer period of time because there's more of it. And of course, you know, by increasing the available amount of dopamine, either through some kind of supplementation or creation of dopamine, manufacture of dopamine, or by slowing down the reuptake or the reabsorption of dopamine, it has the effect of increasing the net amount of dopamine someone can reabsorb, someone can have available to them, and that calms down the symptoms such as tremor, muscle stiffness, slowness. Right? They also use parasympatholytics. Now, I'm only going over these mechanisms because I think that they're interesting. That's the only reason. And you know, the more you know, the farther you go, as they say. So a parasympatholytic agent. Lytic means lice or cutting. Is a substance or activity that reduces the activity of the parasympathetic nervous system. So parasympathetic, para like parachute, like being able to rest and digest, right? So too much parasympathetic activity would mean drowsiness, right? And so the parasympatholytics would slow down the parasympathetic effects, and the dopaminergics would increase the net availability of dopamine. When someone has Parkinson's and they're taking drugs for Parkinson's, you have to watch out for dizziness and drowsiness. People also might be disoriented. How many times have you or I gotten up from some kind of bodywork treatment, whether it's massage or acupuncture or whatever, and felt like, wow, my mind is like in another realm right now. There can be nervousness, low blood pressure, especially when changing position. That's orthostatic hypotension. If you want to relax the muscles, some of the best strokes to use are effleurage and rocking strokes, and then maybe some petrissage. if they're too relaxed or too sedated, you can stimulate them using strokes towards the end of massage, like tapotement and fast effleurage. Isn't that a great thing about body work? You can actually manipulate the nervous system. It can actually affect someone's entire body. If you're using your hands and your intention, it's pretty incredible. If your client is dizzy, drowsy, or disoriented, offer to help him or her get up from the table. Because if they are dizzy or disoriented and they try to get up from the table, hold on a second, guys. Come over, Max.
Yeah.
Come over. No, come here. As my 14-year-old who thinks he's got it down, is like walking around with a spoon in his mouth. He's also one of the clumsiest people I know. And now that he's growing, he occasionally just like bumps into things. So he's got this long metal thing pointed right at his throat. And he's walking around like that's a good idea. So sorry, I had to have a little emergency intervention there for preventive intervention. All right, cardiovascular disease. So cardiovascular is circulatory system, which includes the vasculature and the cardia, the heart. So that includes things like heart failure, vascular diseases, like any disease of the blood vessels, which means coronary artery disease, valve diseases, any disease of the heart, right? And if someone has had cardiovascular disease, if they have had heart failure, if they have stents, if they have high blood pressure, if they've had a stroke, keep in mind that the integrity of their blood vessels is not as solid. It's not as high, not as reliable as someone who doesn't have cardiovascular disease history. And there's a lot. It's the leading cause of death in both men and women in the United States. Some common medications. You have to watch out for bruising, right? So lower integrity in the vasculature, often combined with drugs that inhibit clotting or thin the blood, means that when someone has a cardiovascular disease history, you have to watch out for bruising. And the bruising is made worse by anticoagulants, non-steroidal anti-inflammatory drugs, aspirin, corticosteroids. And then we get into the questions. So we can go back through some of these questions. If any of you want to review any of these questions, just let me know. I also have a few other questions from, these are questions from the FSMTB exam. You guys may remember a few nights ago. Okay, this is not gonna let me in right now. You guys may remember that a few nights ago, I walked you guys through this, and I managed to complete the practice exam, which has 100 questions, and I got some insight from that. I'm pleased to say that some of these questions, the like exact wording of the question, I have found on other testing sites. Some of them are new. Some of the questions are new. So I have found, I think, 5 or 6 questions related to this section of pathology that I think it would be useful for us to go over. So let's do that now. Unless you want to go over any of the other questions from the AMTA that we did in the beginning of class, we can do that too. Do you guys have anything you want to go over from the AMTA? No? Okay. Yep. Dora, you have something?
No, whatever is fine by me.
Okay, all right. Okay, so try not to look at the answer. So a depression that remains in a client's tissues after a practitioner applies and releases firm pressure to the area is an indication of which one? Inflammation, diabetes, pitting edema, or muscle contusion. Inflammation, diabetes, pitting edema, or muscle contusion. What do you guys think?
Diabetes.
Yeah, that's not a bad answer, but of the 4 questions, it's not the most direct, right? Because edema, like a depression that remains in client's tissue after you apply pressure, diabetes can lead to that.
No.
But the depression in the tissues when you apply pressure, that is a result, most direct result of pitting edema. That's actually called pitting edema. It's the result of edema. It's called pitting edema. Okay, so pitting edema is part of diabetes. More specific than diabetes. Okay, where's the next diabetes question? Where's the next diabetes? Okay, so this is not about medication, but about the condition diabetes and also special populations. Which of the following conditions is associated with pregnancy? Is it dysmenorrhea, hyperthyroidism, gestational diabetes, or pelvic inflammatory disease? So what does dysmenorrhea mean? So Vincent,
Yes.
what is meno or menor? What does that mean? Yeah, close to
mental.
menopause.
Mental. Well, not mental. I'm sorry. I was thinking menopause, and then what it stands for, and then go through there.
Yes, you are on the right track. Absolutely. So menopause. Pause means pause.
Mid.
And meno means what?
Mid, I believe.
No, what happens during menopause? What is it that stops?
Your period.
The period, yes. How did you manipulate your voice like that, Vincent? That's amazing.
I'm sorry.
So during menopause, the menses stops. The menses, right? Therefore, menor or meno means menses or period. So then menor or menorrhea means menstrual or menses. And what is dys? What does dis mean? It's basically short for
disorder, right?
Disorder or dysfunction. Yeah.
Dysfunction. Okay.
Dysfunction. Yeah. Disorderly, dysfunctional menses. So dysmenorrhea, usually it refers to the chief, it's a bunch of symptoms, but the chief symptom is severe pain. Which condition is associated with pregnancy? Is it painful periods?
No.
No. Is it hyperthyroidism?
No.
No. Is it gestational diabetes?
It can be.
Yes, it can be. But of those 3, which one is it so far?
The closest one would be
gestational diabetes. You definitely would pick it out of multiple choice, no problem. And then pelvic inflammatory disease, PID, that can exist in or out of gestational diabetes, right? So that's not unique to pregnancy. So it's gestational diabetes. So that's another thing. It's like a population question, special population question on pathology. In the pathology section, they want to know, what do you look out for in someone who has pregnancy? You know, what do you understand about someone who's pregnant? What do you understand about someone who's over 60, someone who has a cardiovascular history? Special pops, someone who has arthritis. Speaking of arthritis, let's move on and see what kind of questions there are about arthritis. So which of the following would increase flexibility? Sorry, hold on a second. Which of the following would increase flexibility for a client who's diagnosed with chronic rheumatoid arthritis? Would that be heavy tapotement on the surrounding muscles, passive range of motion of the affected joints? Would it be cross fiber friction distal to the affected joints? Or would it be the application of cryotherapy? You know, I know the question's highlighted, but, you know, look at each of them and see which one makes sense to you. Does passive range of motion of the affected joints make sense for someone who has chronic rheumatoid arthritis to increase flexibility? We'll take that as a yes. You guys got to let me know if the answer is no, because this is your time to clarify those things. All right, palpation. What's palpation mean?
Means you're tapping.
That's percussion. That's
Oh.
percussion. Yeah. So when you palpate, or when you do palpation, that's feeling. So that's exploring the tissues for the purposes of diagnosis. There's a few different ways that we diagnose. One is through asking. That's like taking the health history, right? One is looking, like the visual assessment. Is there redness? Is there swelling? What is this person's walking like? What is this person's range of motion like? And another one is through touch, palpation, right? And there are other methods too, like listening, for example. When you use where'd this thing go? Oh no, did I just? Oh no. Yes. Yes. There we go. All right. Nice. So palpation can assess tissue, what? Textures, blood pressure and strength,
No.
rhythms, textures and temperature.
Yes.
Yes. Here's an interesting one: elasticity, dehydration, and excitability.
Well, can't do dehydration.
Yes.
So cannot.
No, can't really do excitability because that's the measure of how easily nerves respond, how easily nerves conduct nerve impulses. And elasticity, you have to have someone move for that, or you have to do some kind of range of motion. Could be passive, but you have to do usually some kind of stretching to see what elasticity is like. And contractility, you have to have them contract their muscles. Sensitivity means their ability to detect pain or to feel sensations, actually. And then end feel could be done through palpation, but that's like when you get to the end of someone's range of motion. If you're stretching them, like what do you feel at the end of that range of motion? Does it feel springy and spongy, or does it feel like bony, hard, and blocked? So yeah, it's rhythms, textures, and temperature. Rhythms, textures, definitely textures and temperature. What does rhythms mean? Oh, heart rhythms, heartbeat, for example. Also, what other rhythm can you detect through the body if you're trained in it? The pulse of the cerebrospinal fluid, and also the respiration, heartbeat, and cerebrospinal fluid. Okay. In which of the following cases is a hot pack to the abdomen contraindicated? Flatulence, constipation, abdominal trigger points. Hot pack sounds good for all three of those. High blood pressure. So why is it contraindicated for high blood pressure?
Because it can make you dizzy.
It can make you dizzy, but I think it's actually because it increases the blood flow. Let's see if I can get a definitive answer. High blood pressure. I'm not actually seeing much there. It's just like the same. question verbatim. Okay. Let's see what else we got. Blood or blood pressure. Yeah. A primary concern for treating a client who has peripheral neuropathy. That may be a term that we didn't go over. Peripheral neuropathy is a general term describing disease affecting the peripheral nerves, meaning nerves beyond the brain and the spinal cord. So that's the nerves in it can be the nerves in the torso and abdomen, etc. But it's really the nerves. What they mean is the nerves in the limbs, the arms and the legs, especially the hands and the feet. So neuropathy or peripheral neuropathy is disease that affects the peripheral nerves. So when you have peripheral neuropathy, you have things like numbness, tingling, pain. There's often inflammation, swelling, redness. Let's see. Sensory nerves that receive sensations. Wait. There's a classified signs and symptoms are. Yeah, so numbness, prickling, tingling. Sometimes there's pain or there can be sharpness or jabbing sensations, very extreme sensitivity to touch, pain where you shouldn't feel pain, like when someone walks, or the weight of a blanket on the feet, poor coordination and falling, muscle weakness, feeling like you're wearing gloves or socks when you're not, and paralysis. Heat intolerance, excessive sweating, bowel or bladder problems, and then drops in blood pressure. So a primary concern for treating a client who has peripheral neuropathy, which you would see in like diabetes patients, common in diabetes patients, sometimes with high blood pressure or sometimes cardiovascular disease. What's a primary concern? That a client's blood pressure may drop too low, that a client may be hypersensitive to pressure, that a client may develop severe headaches, or their client's glucagon level will elevate. This is a challenging one, right? Because I would definitely home in on the blood pressure thing, even though they're more likely to have high blood pressure than low blood pressure. But the most correct answer is the hyposensitivity to pressure, And they could be hypo or hypersensitivity, right? So damage to the sensory nerves may mean that they don't feel things, or that they feel things too strongly. This is definitely a good one for you guys to review and think about. Put this on the review. You just a second to do that. I think there's one more blood question. No, looks like we got them all. Oh, here we go. While working with a client that has been taking a prescribed non-steroidal anti-inflammatory drug, the practitioner would consider the client's what? Loss of connective tissue integrity, vulnerability to muscle contusions, frequent need to urinate, hypersensitivity to blood clots. Does vulnerability to muscle contusions make sense for someone who's taking NSAIDs, non-steroidal anti-inflammatory drugs?
Yes, but I would also say D as well.
Hypersensitivity to blood clots, because sometimes cardiac patients are given NSAIDs. Is that one?
Yes.
Yeah, but cardiac patients are given NSAIDs in addition. They're given NSAIDs as common medications that cause bruising, in addition to things like anticoagulants, which directly treat cardiovascular disease, or beta blockers, which directly treat cardiovascular disease. So the non-steroidal anti-inflammatories, they would be to reduce inflammation, probably targeting the blood vessels, but also systemically. That it have a systemic effect to reduce inflammation, and they also have a pronounced effect on what sensation. That also aspirin also treats. NSAIDs are also used to treat algesia. Algesia means
Allergy.
Not quite, no. Tylenol, NyQuil, Excedrin. It's on all these medications, right? It's pain. Pain. They often give they give non-steroidal anti-inflammatories as medication to reduce pain. Don't forget people who have cardiovascular disease or Parkinson's disease and diabetes. These are conditions that are advanced. They may not have an advanced cardiovascular disease. I don't mean like, late stage heart condition. What I mean is that it's been years in the making, unless it's genetic. It's been years of, high stress, poor diet, low exercise, right? So as a result, they've accumulated lots of other stuff. Like in someone who's 60 years old who has cardiovascular disease, you often will see chronic low back pain, herniated discs, spinal stenosis, osteoarthritis, sometimes rheumatoid arthritis. You may see co-occurrence of things like diabetes along with cardiovascular disease, because these people have pushed their bodies in certain ways, either through repeated eating of foods that are high fat, high processed, high salt, high sugar, or through lots of overwork and lots of stress, or all the above. I treated a guy who ate once a day. He had like a 12 to 16 ounce steak and a glass of red wine for dinner every night, and that's all he ate all day long. Maybe had like a cup of coffee or something like that in the morning. And he's a partner in a law firm, like big, thick, robust guy. Some people are just built like that, and other people they totally depending on genetics, they can't lower their blood pressure or their blood cholesterol levels no matter what they do, because they get it from your Aunt Edna sometimes, So somebody can have a poor diet and not develop any of these things, and other people will develop everything, like regardless of what they try to do. But if somebody has cardiovascular disease, oftentimes they take more than one medication because they have more than one problem happening. So then loss of connective tissue integrity, what condition can that happen with? What disease can that happen with? I'll give you some choices, okay? Diabetes, cardiovascular disease, Parkinson's, or arthritis.
Parkinson's.
I think maybe Parkinson's, but it's most common in patients who develop neuropathy, and those patients have diabetes. And then vulnerability to muscle contusions, that's cardiovascular, or medications that treat pain or that thin the blood. Frequent need to urinate, you would see that also in cardiovascular patients, but not due to NSAIDs, due to what drug? When you urinate, you're in, it's also called dia, like a cross, and then rhea, diuresis. My son's laughing at me. Diuresis refers to water that is moving out of the body or going across a membrane, right? Diuresis, right? The process is called process of peeing as a diuretic. So that's the thing that makes that induces diuresis is a diuretic. I'm sorry. thing that induces diuresis is a diuretic. Oh boy, uretic, as in urine, as in urinate, right? So patients who are taking a diuretic, patients who take diuretic would have the frequent need to urinate. Hypersensitivity to blood clots. That's sensitivity to blood clots. That's the propensity to form blood clots. So those patients also cardiovascular, history of heart attack, stroke, aneurysm, thrombosis, embolism. Those all are things that are treated with anticoagulants. Diabetes, arthritis, arthritis, blood, while working with a client that has been taking a prescribed oh wait, this is the same question. Okay, all right, good. Okay, guys, any questions about medications? Are there any of the questions you guys want to go back over? All right, good enough. So I'll give you guys a choice what we do for the next 10 minutes. We can either review the basics, you can go over the orientation terms, the planes and joint movements like we always have. I don't think that's ever too much. I think we always need that practice. I could drill you guys on some specific types of movements and which muscles are firing contracting concentrically versus eccentrically. We can go over agonists, antagonists, and synergists. We could practice a little bit of the cardiovascular information. We could review some of the histology of muscles. Do you guys have a preference? If not, I'm going to pick something.
You can pick.
Yeah,
Okay.
it's fine.
Okay, joints. We should do these. We should practice these. So joints. So yeah, let's start with these. Recall that there are different ways of classifying joints. The two ways of classifying them are by their structure, right? So fibrous means things like sutures, and those are immovable. So the sutures between the plates in the skull, the sutures that are in the manubrium, the sternum, from the sternum to the cartilage of the ribs. Those are fibrous joints. And then cartilaginous, immovable hyaline cartilage, for example, the sternum. Oh, those are between the sternum and the ribs. I'm sorry. So fibrous includes the manubrium and the sternum. Cartilaginous includes the cartilage of the ribs and the sternum. And then there's the pubic symphysis and the discs between the vertebrae, intervertebral discs. Those are cartilaginous. Cartilaginous permits some movement. And then synovial permits the most amount of movement. Those are plain joints, like the ankle is a plain joint. The ankle also has a hinge in it. It's also a hinge joint. Other hinge joints include the knee and the elbow. Pivot joints, examples of pivot joints, you need a drawing for this one. Pivot joints are, the neck is a pivot joint. Also, that's because of the atlas and the axis, the C1 and C2 in the neck. Also, I guess that's all the imagery that we have. Also, the radius of the elbow is a pivot joint. Condylar joints. Condylar joints include what is that thing called? It's like a shallow ball and socket, oval or egg-shaped, and it's found primarily between the carpals and the radius and ulna. I don't know exactly what that joint is called. The carpals and the radius. Yeah, condylar joint. Yeah. And in the saddle joint, there's only one saddle joint in the whole body, and that's at the base of the thumb, between the first carpal, the first metacarpal, and the radius. And then there's the ball and socket And there's are there 3 ball and sockets in the body? One is the shoulder, which is a shallow socket and a big ball. One is the hip, which is a big socket and a smaller ball. So a deeper socket and a smaller ball. One of the questions I see asked sometimes about saddle joint is which joint has both convex and concave surfaces? And if you look at the joint, this part here, the edges, they're coming up, right? This is coming up. Here's the bottom of the joint. Here's the top, it's coming up. Here's the bottom of the joint for the top one. And here's this edge coming up, protruding out. So that's convex. And then there's a bend here in this top bone. And there's a bend here in this bottom bone. And those are concave surfaces. So concave on the bottom bone, there's concave and convex. Bottom bone, convex, concave. Top bone, convex and concave, concave and convex. Yeah, so it's the movements, and then it's the structure of the joints. So, and fibrous, cartilaginous, and synovial, no movement, some movement, and a lot of movement. They're also called synarthrosis, amphiarthrosis, and diarthrosis. So syn, like two being made into one, like synthesizing. And then amphi means some. So those are the cartilaginous joints. Synarthrosis are the fibrous joints. Diarthroses are the synovial joints. Diarthroses are the synovial joints. Cartilaginous are amphiarthrosis. Fibrous joints are synarthrosis. For muscles, there's also a few different ways of classifying them, right? So one is morphological, and that's striated and smooth. Another way of classifying is by function or functional. That gives us voluntary and involuntary. And then they're generally considered to be 3 types of muscles in the human body. So the skeletal type, cardiac type, and the smooth type, right? Remember that muscles are made up of fascicles. Fascicles contain myofibers or muscle cells or muscle fibers. Myofibers contain myofibrils. Myofibrils contain myofilaments, and myofilaments are made up of actin and myosin. Actin and myosin. The flow of blood throughout the heart, superior and inferior vena cava into the right atrium into the right ventricle. That goes through which valve, tricuspid or bicuspid? Tricuspid is on the right. If you want to be right, you have to try.
Cuspid.
Tricuspid, that's right. And then from the right ventricle into the pulmonary artery through the pulmonary valve, which then goes to the lungs to be oxygenated. The oxygenated blood returns through the pulmonary veins, which goes into the left ventricle and left atrium. Letter A is on top, letter V like a valley is on the bottom. So oxygenated blood from the lungs through the pulmonary veins into the left atrium, from the left atrium into the left ventricle through which valve, bicuspid or tricuspid? If you want to be right, you have to try. If you're on left,
Yeah, it'd be a ventral valve.
that'd be the mitral valve or the bicuspid valve. Yes. Left ventricle through the bicuspid valve into the aorta, through the aortic valve, into the aorta. Okay. So we talked about intrafusal muscle spindle fibers, also Golgi tendon organs. Those are both sensory organs. Which one does reciprocal inhibition, which is the inhibition of the antagonist? Which one does inhibition of the antagonist? Is that the intrafusal muscle fibers or the Golgi tendon organs?
Intrafusion. Fusion.
Very nice, very nice. And which one does activation of the antagonist? Golgi tendon organs or the intrafusal muscle fibers?
Golgi.
Golgi, very good, very good. Yeah, sharp. That's good. I like that. I like that. Very good, very nice. Just a couple more minutes, and then I have a special announcement for you guys. So concentric and eccentric. Wow, we could spend 2 hours doing just concentric and eccentric. Okay, so extending the neck, extending the neck. Where's the concentric contraction if you extend the neck?
In the back.
In the back, that's right. And where's the eccentric contraction if you extend the neck?
In the front.
That's right. How about for lateral flexion to the left? Where's the concentric?
The left, you said?
That's correct, the left. Oh, you're asking, did I say the left? Yeah, lateral flexion to the left. Where's the concentric?
Right.
To the left.
To the left, to the
Oh.
left. So the concentric is on the side that what, shortens or lengthens?
Shortens.
Yes, Dora,
Yes,
shortens or lengthens concentric?
shortens.
Yes, and eccentric, humor me, shortens or lengthens?
Left, lengthens.
That's right, that's correct. Okay, holding a suitcase in your hand and lowering it down, putting it down on the table, is your going like this, so going from flexion down into extension. Is the anterior delt concentric or eccentrically contracting?
Say that one more time.
Yes, so your arm is up and you're lowering it down. Is the anterior deltoid contracting concentrically or eccentrically?
Essentially.
Very good, very good. And if you continue into extension, reaching back behind you, is the posterior delt contracting concentrically or eccentrically?
Concentrically.
Very good, very good. Yes. Squeezing the knees together, where's the concentric contraction? Which muscle group? Which muscle group is shortening if you squeeze the knees together?
The tibial.
Muscle group, not names of individual muscles.
Oh, okay. Well, the quads.
No, not the quads. That would be inflection.
Okay.
This squeezing the knees together is actually what movement? Flexion, extension, abduction, or adduction?
Adduction.
That's right. So which muscle group is concentrically contracting? The abductors, the adductors, the flexors, or the extensors?
Adductors.
The adductors, that's right. And name one or two muscles in the adductor group. They have adductor in their name. I hear pages turning. This is good. That is, oh, okay.
Go ahead.
So adductor magnus, adductor longus, pectineus, and also gracilis. All right.
Longest.
Yes.
Well, all of them, right? Or would it be
No.
most just the longest?
Anything that has the word adductor in it.
Okay.
So I think there's three of them actually: adductor magnus, adductor longus, adductor brevis. And there's also the gracilis and the pectineus. So I'm going to stop recording now.